I went to school at the University of Alberta in Edmonton and got my training in family practice there. I practiced 5 years doing family practice and obstetrics, and got, I think, a good basis of medicine. It was a busy practice, and my wife and I decided that we should go back to school, so we went to Mayo Clinic in Rochester. And there I had the opportunity of learning about anesthesia and becoming an anesthesiologist. I also got training in pain management there and came to work with Southern Arizona Anesthesia Services, which is a large group in Tucson. And I practiced with them for 17 years doing essentially all their pain management on the east side of town. I got the opportunity to join with Dr. Gosler, and we formed the Pain Institute of Southern Arizona 7 years ago. And we've enjoyed our practice since that time. We do a lot of spinal cord stimulation in our practice, and spinal cord stimulation is a very gratifying procedure. I had a patient early on in my practice when I hadn't used a lot of spinal cord stimulation, and it involves placing a couple of wires in the spine. She had been having trouble with back pain for years and had a number of operations. Unfortunately, the operations weren't successful, and I think she ended up with about 5 operations on her back, had continual low back pain and leg pain. And she came to me with this problem, and we were able to implant 2 electrodes, we call them, in the spine. These are wires done through needles, and she experienced excellent relief of her low back and leg pain, and she's been very grateful for that relief. When I thought about this question, and the answer I came up with is, who would I choose to be my doctor? And as I went through this, I thought I would want somebody who was willing to listen to me, who had my best interest at heart. Somebody that had good training, somebody that had a good reputation, and somebody that obviously had good judgment to sort of put this all together. I believe that that's the kind of physician that I would like to have, and that's the kind of physician that I try to be for my patients. I was trained at Mayo Clinic in Rochester. I've been selected as the best doctor for the last 10 years. That's been a great honor for me, and I think a lot of that is because I do listen to my patients. When the patient leaves the room, I ask myself the question, have I been able to help that patient? And I think that has served me well through the years. I have a number of interests. I don't have a lot of free time as we work in our clinic. We're pretty busy, but when I do get a break, I like to ride my motorcycle. I have scuba dived, which is really a lot of fun, but I don't get the opportunity too often. We go down to Mexico frequently as a family and spend time at the beach, and that's a lot of fun. And in the wintertime, I enjoy skiing. As our family grows, I've got 3 boys and 2 daughter-in-laws, 3 wonderful grandchildren, and we really enjoy vacationing together.